Peptides are everywhere right now. They're on social media, they're in podcasts, they're being talked about as shortcuts to longevity, fat loss, healing, and optimization. And here's the thing: peptides are real science. They're not magic and they're not fake, but they're also not simple. And that's where the problem starts because the same word, peptides, is being used to describe two very different worlds. One is modern regulated medicine, and the other is an online marketplace driven by hype, anecdotes, and very little human data. And if you actually want to make sense of peptides, there are three things you have to understand: what they are, how they're made, and how they work in the body. Miss any one of those, and you're not really evaluating peptides, you're evaluating stories. So today, I want to slow this conversation way down and start at the foundation, not as an influencer, not as someone selling you anything, but as a trained scientist, someone who works in molecular biology, regenerative medicine, and biochemistry, and spends their time understanding how these molecules are built, how they behave in the body, and how to interpret the data behind all of these claims. This is episode 1 of a 3-part series all about peptides. And today on the ReProgram podcast is about understanding the molecules themselves, because without that, it's impossible to honestly assess either the promises or the risks. Hello, everyone, and welcome to the ReProgram podcast. I'm your host, Dr. George Murphy. So before we get technical, I want to be very clear about my lens today. I'm not here to tell you what to take. I'm also not here to optimize you, and I'm definitely not here to sell peptides. What I am here to do is to help you think clearly. As a scientist, when I look at the current landscape, I see 3 very common negative outcomes of taking peptides that almost no one talks about honestly. So here they are, and you'll hear these throughout the entire series. So, number 1, the peptide does nothing. It's biologically benign. You take it, you lose money, but not your health. Number 2, the peptide actually does something, just not what you think. It hits the wrong target or multiple targets, and because there's limited human clinical data, you don't actually know what downstream effects you're triggering. And number 3, the peptide isn't what it claims to be, or it isn't clean. Contamination, mislabeling, or maybe a sterility failure. And this is where consequences can become serious. So you'll notice that this is an escalation from wasted money to unintended biology to real risk. So everything in this episode is about understanding why those 3 outcomes are so common. Okay, let's start at the beginning because this part gets oversimplified constantly. Amino acids are often called the building blocks of life, and that's not an exaggeration. They're the raw materials your body uses to build everything from muscle to enzymes to hormones. So when amino acids link together, they do so through something called a peptide bond. So if you link up just a handful of amino acids together, you get a peptide. If you link many, sometimes hundreds or thousands, you get a protein. So peptides sit on a continuum: amino acids, peptides, proteins. Now, this is where people make their first mistake. They hear short chain and assume simple, but short does not mean insignificant. So think of it like language. A protein is a long paragraph. A peptide is a sentence, and sometimes a single sentence can completely change what happens next. Now, here's the part that really matters. The exact sequence of amino acids in a peptide determines what it does. And I mean exact. Change one amino acid, just one, and you may completely change which receptor it binds to, how tightly it binds, how long it stays active in the body, whether it gets broken down quickly or lingers, and whether your immune system sees it as self or foreign. So this is why in biochemistry, we say structure determines function. With peptides, structure is everything. So, a useful analogy here is a key and a lock. A peptide is like a molecular key. The receptor is the lock. If the shape is right, the door opens. If the shape is slightly off, nothing happens. And if the shape is wrong but still fits, you might open a door you never intended to open. That's where off target effects come from. So, how about some examples you probably already know but don't realize? Some of the most powerful signaling molecules in your body are actually peptides. So, for example, insulin is a peptide hormone. Glucagon is also a peptide. Oxytocin, often called the bonding hormone, that's a peptide too. And growth hormone releasing factors are also peptides. Many of the immune signaling molecules in your body, those are peptides too. So these molecules don't provide energy, they don't build tissue directly. What they do is send instructions. They tell cells grow, divide, release something, stop releasing something, move, don't move, survive, die, etc. So peptides function less like fuel and more like code. And when you inject or ingest the peptide, you are inserting a line of biological code into a system that is already incredibly complex. So peptides are powerful precisely because they interact with fundamental control systems in the body. But power without precision is where problems arise. So if a peptide maybe binds to more than one receptor, behaves differently at different doses, or hasn't been studied well in humans, then you may not be getting the effect you think you're getting. You may be getting an effect, just not a controlled one. And that sets the stage for the three negative outcomes we talked about earlier: no effect, wrong effect, or serious consequences. So, one of the biggest misconceptions I see over and over again is this idea that peptides are natural and therefore safe. The word natural carries a lot of emotional weight. It sounds gentle, it sounds familiar, it sounds like something your body already knows how to handle. And sometimes that's true. Your body makes many peptides naturally. They act as signals, as we discussed, telling cells what to do, when to do it, and also when to stop. But here's the part that gets lost in online conversations. Most peptides people are taking today are not identical to the ones your body makes. They may be based on natural peptides, but they are often changed on purpose. Why? Because natural peptides don't usually last very long in the body. They get broken down quickly. This is how biology keeps tight control. So, to make a peptide work better, last longer, or feel stronger, changes are made, and those changes matter. So, what does modified actually mean in plain language? Let's keep this simple. Some peptides are deliberately changed so they hold their shape more rigidly or survive longer in the bloodstream, resist being broken down too quickly, or perhaps so they can move differently throughout the body. So, a familiar example is the class of GLP-1 drugs used for diabetes and weight loss that we discussed in our previous podcast episode. So, your body already makes a natural GLP-1 peptide, but it only lasts a few minutes before it's broken down. So, the versions used as drugs were modified on purpose to last much longer, circulate differently, and send a stronger, more sustained signal. So, those changes are exactly why these peptides work as medicines. But they're also why these drugs do not behave the same way as natural peptides do that your body produces. And that's a key point. Once you change how long a peptide lasts, where it goes, or how strongly it signals, you've changed the biology. If you change the shape of the molecule, how long it sticks around, or where it travels, you've changed how the body experiences it. So, a helpful analogy is this: it's like taking a word from a sentence and bolding it, underlining it, and repeating it over and over. The message may be based on the original, but the emphasis is completely different. This is why, when I hear someone say it's basically a natural peptide, my scientist brain immediately pauses, because the real questions are: natural compared to what? The original version made by the body, or a modified version designed to behave differently? Once a peptide has been altered, even slightly, it is no longer guaranteed to act like the original biology. It may bind more strongly, it may bind longer, it may interact with more than one target. And that's not inherently bad, but it is uncertain. This brings us directly to the second negative outcome we talked about earlier. A peptide can absolutely do something, just not the specific thing that you intended, because biology is not a simple, single lock and key system. Many receptors look similar, many pathways overlap, and when you push one signal harder or longer than nature intended, other systems can respond. This is where people say, I felt something, so it must be working. But feeling an effect doesn't tell you which pathways were affected or what the long term consequences might be, especially when human data is limited or completely non existent. One last important point: synthetic does not automatically mean dangerous, and natural does not automatically mean safe. Synthetic simply means made or modified by humans. So, some of the safest, most effective medicines we have are synthetic or modified versions of natural molecules. The problem isn't modification itself, the problem is assuming predictability where we don't actually have it. Okay, so now we've covered what peptides are and the differences between peptides your body makes and peptides that have been changed to behave differently. The next logical question is, how are these molecules actually produced? And how does quality enter the equation? Because once you move from natural biology to manufactured molecules, precision and cleanliness become everything. And that's where the stakes rise even further. Now, let's talk about how peptides are actually made, because this is the least glamorous part of the story, but arguably the most important. When people talk about peptides online, they almost never talk about manufacturing. But with molecules this precise, how they're made matters just as much as what they're supposed to do. So most peptides today are produced using a process called solid phase peptide synthesis. You don't need to remember that name, just remember the concept. So this method builds a peptide one amino acid at a time, like assembling a word letter by letter. Each new piece is added while the growing peptide is attached to a solid surface, basically a microscopic workbench. So that setup makes the process efficient and repeatable. It's also where problems can start and why precision matters so much. Okay, so for this process to work correctly, every single step has to go right. Each time a new amino acid is added, it has to be the correct one. It has to attach in the correct direction. It has to fully connect with no loose ends. And temporary chemical caps have to be removed at the right moment so the next piece can attach. If even one of those steps doesn't work perfectly, you don't get an error message. You get a peptide that looks fine, but isn't. This can result in missing pieces, small sequencing errors, extra chemical leftovers from this process, or even a mixture of slightly different peptides instead of one clean product. So maybe think of it like assembling IKEA furniture with one wrong screw in the middle. The shelf may stand, it may even look normal, but it's not what the instructions intended, and stress it in the wrong way, and it fails. This is why purification is not optional. So after a peptide is made, it has to be carefully separated from incomplete versions, incorrect versions, and leftover chemicals that were used during assembly. So this is why identity testing matters. Manufacturers use tools to confirm that the peptide has the right size, the right sequence, and is actually what the label claims. Without these steps, you're not dealing with a single defined molecule. You might be dealing with a mixture, and biology does not like ambiguity. Now, let's connect this back to real world outcomes. If a peptide is partially degraded, or maybe under purified, incorrectly stored, or weaker than advertised, the most likely outcome is nothing. Your body breaks it down, it never reaches its target, you feel no meaningful effect. That's outcome number one, biologically benign, but financially expensive. But there's a much more serious failure mode. If a peptide is contaminated, mislabeled, incorrectly mixed or not sterile, especially if it's injected, that's where risk escalates quickly. Injectable substances bypass many of the body's natural defenses like digestion, skin barriers, and first pass metabolism in your liver. There's no buffer, which is why sterile manufacturing and handling standards exist in the first place. This is also why the FDA has repeatedly warned about unapproved peptide products that are being sold online, that are often labeled for research only, that are being used in people. So I know some of you out there are using products like this and have seen these very labels for research use only, not for use in humans. Let me be the first to tell you that you are not a laboratory animal, and these warnings aren't about innovation. They're about quality, cleanliness, and safety. Because when something goes wrong, with an injectable in particular, it doesn't just go wrong quietly. Okay, so let's bring this all together. When someone asks me, what's the worst that can happen with peptides? My answer is not dramatic, it's structured. The best case negative outcome: nothing happens. Your body ignores it. You wasted your money. The middle case negative outcome: something happens, but not what you intended. The peptide binds elsewhere. Maybe it triggers unintended signaling. And because we lack strong human clinical data, you're now flying blind. And of course, the worst case negative outcome: there's quality failure, contamination. Maybe it's the wrong compound or there's a sterility breach. And here's the part that matters most. Social media tends to talk about only intended benefits. Science, on the other hand, is trained to think in terms of failure modes. That difference explains almost all of the tension around peptides right now. In the next episode, we're going to take this framework and apply it to the peptides people are actually taking. We'll talk about healing and performance peptides, what they're claimed to do, how they're supposed to work in the body, and what the clinical data does and does not tell us. That includes one of the most talked about peptides right now, something called BPC 157. Then in episode 3, we'll look at regenerative and so-called anti-aging peptides, the ones tied to things like longevity, tissue regeneration, and optimization. We'll examine the biology behind those claims, where the evidence is strongest, where it's thin, and how to think clearly when human data is limited. Across both episodes, the goal stays the same: to separate mechanism from marketing, possibility from proof, and curiosity from certainty. Because if someone is selling certainty in a space full of uncertainty, that's not confidence, that's marketing. This is the ReProgram, and this series is about replacing hype with understanding. So I hope you enjoyed this discussion, and please follow our podcast and join me on this journey of understanding and self-discovery as we navigate our way into the fields of longevity, aging biology, regenerative medicine, and the emerging field of geroscience.